So, Ali, how was your week?
It's been a good week, but a busy week for a change. Um, I-
I'm going to have to get a clip of every single episode where you say the same thing.
the thing is, that's how the weeks go. No, it was a week that culminated in a course over the weekend. It was an implant treatment planning course, and we had 10 delegates down from all over the UK. Really cool group of people because we had some people who have never placed an implant, and we had someone who's a max fac surgeon who's done a lot of oncology implants, but hasn't had to deal with dental restorations, and so a range of experience. And yeah, it was a really nice day because it's quite often I say this that we get groups of really nice people, but they were all there to help each other, and it made it a really easy day. So I had a great week. Thank you.
Oh, well, that sounds amazing. I think it's really interesting with the talking about sort of that restoration as well. I was listening to a podcast, the Producer Dental podcast. Sorry to shout another one out, but it was an old one. But they were talking particularly about how there's so many more factors to think of with peri-implantitis than periodontal disease. And yeah, I do think it's worth not only having to think about, that smoking and diabetes, but, the design of what you're putting in, the collars, the abutments and everything. So there's a lot there, which...
There is a lot there, and we did talk about all of that, but even beyond that now, there's things that we didn't realize are relevant to this. So I'm going to shout out to Zero Bone Loss Concepts and Adam Gavani, who is the Flying Dentist UK, who had his case shared on Zero Bone Loss Concepts that he's managed to rescue a failing implant. And I messaged Adam saying, how did you do this? Because the bone's grown back on and it goes against everything we understand. And he's going to publish a protocol. But we're realizing that biology and prosthetics and all the things we do and the patient does all come together. But there was the paper that you and I looked at last year that was looking at the osteoimmunology and the fact that osseointegration is a misnomer, and actually it's shield off bone forming around our implants. And I mean, this is a topic for another day, but it's really interesting that everyone is realizing, the surgeons are realizing they need to be better with the prosthetics, the prosthodontists are realizing their surgery matches, the periodontists are thinking, actually, we've been right all along until that paper came out. And there's no specialty that has ownership over implants. And the reason for that is maybe we need to be working in bigger teams, even within one small treatment plan, so that we can tick all of these boxes.
Oh, yeah, I completely agree. Well, I mean, it was I remember last year when you talked to me about, oh, do you want to go into implants, sort of get in there nice and early? And I said, I need more of that general dentistry scope before I think jumping in, because it is, so impressed with anyone that does implants. There's so much to have to consider, and I think it can sometimes, well, it never seems simple. It is quite amazing, but it can seem sort of like, oh, we just pop that in there and then something screws on top. But actually, yeah, there's so much to consider with it.
I guess it's the same with whatever you're doing in dentistry, where when you have to explain it to someone else, you don't give them all of the steps because you take some of those steps for granted. There was a good few people on the course that said that occlusion was one of their concerns. Thankfully, Aston was there, and he is the occlusion guru as far as I'm concerned. But we all have blind spots in our dentistry, and actually the more we've worked as part of a team at the practice, the more I've realized that. But yeah, I think one day we'll do a deeper dive into this stuff. But
oh, definitely.
Yeah. How was your week?
I had a good week. I have realised that there's an astronomical crossover between runners and dentists. I was supporting Tom in a race this morning and ran into a lot of dentists.
Oh, wow. Okay. Was it local?
Yeah, just in Butte Park in Cardiff. Very proud of Tom. But yeah, also all the dentists, and dentist one, Emily Fell. So
yeah,
for lots of teeth and running clearly have a good crossover there. But other than that, I've just been doing some general dentistry, organising some stuff for my talks and the dental anal tubules event coming up at the end of the month. And yeah, had some headshots done down at Cardiff Bay as well, which was fun. It's always nice to get nice and dressed up as well.
You came in afterwards and I said, "What are you up to?" And you pointed at your face, and I was like, "And?" So yes, I clearly,
You didn't say what you up to. You said, "Oh, have you done anything this morning?" And I was like, it would be amazing if I'd just, rolled out of bed looking like this.
Sorry, I must be oblivious. Yeah. No, that's showing me that again, when we're talking about our weeks, there's so much going on. Maybe we need to touch on some work-life balance at some point and
Yes,
talk about that.
definitely.
Um,
Maybe next week then.
because we have our ebbs and flows, don't we? We have great weeks where we find our rhythm and where there's a lot happening, but it's all the right mix of stuff and there's enough time to decompress. And then there's weeks where just a few things get thrown into the mix that make it a little more difficult. And I think sometimes we're a bit casual about discussing how much is going on when we're publishing and teaching and speaking and working in practice. And I think it's unfair sometimes on the people that might be listening because it makes it seem like we don't have maybe the same struggle with some of these balances. So maybe we look into that.
Oh yeah, definitely. I know I definitely struggle with that balance. And yeah, I think it's a really important topic
Yeah,
to
brilliant.
cover. But that takes us on to today's topic. And we thought we'd talk today about vaping. It's obviously been all over the news, particularly over the last few months. I thought I'd start with the classic Google what the definition of a vape is. And it's a device used for inhaling vapor containing nicotine and flavouring. But quite interestingly, it's actually not a vapor, it is an aerosol.
Okay.
And that is something that I must admit I actually did not know until doing some research for this episode.
Sorry, what is the difference between vapor and aerosol?
So I think it's to do with the fact that vapor is more, that just almost like steam kind of like, whereas like an aerosol, there's a lot more chemical to it there.
I mean, just off the bat, that's basically throwing droplets into your lungs. So you're coating your lungs in something that, I mean, I don't know if it's that big a difference, but it doesn't sound very nice to me. The aerosol sounds worse.
Yes. But I had no idea.
Yeah.
So they were invented in China in 2003, actually by a guy whose dad passed away from lung cancer. So it was sort of, initially it was that smoking cessation. They came to sort of the USA and the UK kind of mid-2000s, but they really started gaining popularity in 2013. I do remember being in my last couple of years of school and suddenly people had the ones that actually looked a lot more like cigarettes. Do you remember those ones?
I do, yeah.
They weren't as fun. But
was there some kind of event in 2013 that triggered all of this?
I didn't find anything in my research there at all.
Someone must have seen a marketing opportunity.
No, definitely.
Yeah.
And still 90% of that production comes from mainland China.
Okay.
But I wanted to chat a bit. So from your perspective, who do you see vaping?
I was thinking about this when we talked about the topic, and I actually think I've worked in lots of different practices and lots of different areas. And I find it really strange when I was looking at some of the statistics when I was doing some research for this, because I don't have a lot of patients that are smokers or vaping, but the ones that are vaping tend to be quite young. So it's the ones in their 20s that come in and are vaping. And it's every single smoker that comes into the practice, I have to speak to them about the consequences, because I'm just speaking to them about implants and the consequences on implants. And I do have that conversation about, have you thought about stopping? I've always done that. And I used to advise them to go to Alan Carr's Stop Smoking, which I realize is not the comedian. It's a stop smoking program. And that's because one of my patients probably about 8 years ago told me about this program, and they went to a seminar in person, and at the time they paid about £300. And at the end of the seminar, they were told that if you ever smoke again, you'll get your money back and it's guaranteed. And it just completely put them off cigarettes. And the reason I'm saying this is that that's something, if I said, have you thought about stopping? And people said, yeah, but I find it really difficult. that's where I would kind of send them to. Um, I haven't found that a lot of people try to stop smoking by going to vapes, in my experience, but that might be my demographic. But it seems to be the young ones that come in and are vaping but have never smoked.
So, I mean, obviously this is anecdata rather than proper data, but I know in my family, all my siblings over the last few years have tried to stop smoking, and one did it just cold turkey, very impressive. The other did it with vapes, and did the starting with the sort of the normal nicotine one you buy, and then had to purchase sort of the ones where the nicotine reduces until you actually end up on a 0% one. So you're just then, and then it's just breaking that habit, and now they don't vape at all.
Okay.
And did really well. But interestingly about that is, in terms of that marketing, getting the reduced percent nicotine ones is really hard to do, and you can only get them online. You can't get them in the shops.
So it didn't come as a package with all the reduced ones going down as part of a program, because clearly that's not beneficial to the people selling it.
Yes, yeah. And then the last sibling is still trying to break the habit. So has ebbed and flowed going through that program and then sort of bouncing back.
See, and my generation, I can't believe I'm using that term.
2 generations in dentistry.
Yeah, it really is. I mean, when I was growing up, shisha became a thing. And this pipe, what they call a hookah pipe, and it comes, I think it's a Middle Eastern tradition, where you put flavored molasses into this pipe, and you use a coal, and you smoke that. And the marketing changed for my generation, and they thought it makes this nice sound, so they started advertising it in Kenya, where I grew up, as hubbly bubbly.
Okay.
Right, because it's onomatopoeic. It sounds like that. And all of our parents, when we were growing up, just thought it was just flavor. They didn't realize it's tobacco. And it was this thing where this flavor and the smell, and you're playing with the smoke. And it's kind of, everyone realized how much worse it is because of how much more you're smoking, and you're putting a piece of charcoal on top of it. And it kind of reminds me of that, where you've got these people walk past me, and I'm like, ooh, bubble gum, and I'm like, wait, what am I doing? This is terrible, right?
That reminds me actually of part of our finals at Cardiff for my year. The year above, they had to label a shisha pipe as part of one of the exam questions.
Why is that?
No idea. But now I feel like maybe some of the years coming through are going to have to label a vape.
Yeah. That's a strange thing to have to do. I mean, to say it's a shisha pipe is one thing. To have to label the parts.
Label the parts. I know. Incredible general knowledge. But yes, I do think it is scary, that marketing towards the youth. And you only have to walk past these shops, and they're so bright and colourful, and they've got all these flavours like bubblegum and peach and passion fruit and everything. And I was looking at some statistics, and it's a fifth of 11 to 17-year-olds have at least tried vaping, which was up. So that's 20%, which was up from 13% in 2020. And still 7% of them are sort of actively vaping still.
7% are actively vaping.
And that's under 18s. And in this country, yes, it is illegal to sell vapes to under 18s. Currently.
That's incredible, isn't it? Because when you actually look at that, these habits are forming so early. I'd be so interested to see the long-term data from that 7%. But I wonder, do you know what the statistics were on cigarettes for that age group?
So there are more in that age group. There are more people vaping now than smoking.
Okay.
But overall in the UK, so when you start putting adults into it, there's still more people smoking than vaping. So it's around 3 million vaping and 6 million smoking.
So that's interesting, because these kids a lot of them would just not be smoking. It's not just a transfer of numbers. We're actually going to see an increase in the use of these products because of vaping.
Yeah.
Gosh.
And interestingly, in terms of adults who vape, it's 0.6% of adults.
that number must be massively down in the last kind of 10 years to what it was.
Yeah.
I mean, you may not have looked it up, but I still, I still remember when, I mean, I remember when the
Good old
smoking ban
days.
came in,
Yeah.
and you'd go out and you wouldn't smell like smoke anymore, and it was great. I mean, I'm really sad about what's happened in New Zealand because I think reversing what was an incredible law is such a shame. So they had decided that every year, the next year down can't buy cigarettes. I'm not sure if I'm explaining that well.
Yeah.
So that they were going to phase them out in a number of years, and that's been reversed. And it makes me think, who is reversing this stuff? Because why wouldn't this be a good idea?
Well, it is, I think, meant to be coming into this country.
Wow.
I think
Okay.
it's on the cards.
Okay. I was trying to
So
look to see if producer Simon was nodding or shaking his head, whether there's going to be New Zealand style smoking ban, an end to smoking for certain age groups coming into the UK. Have you heard anything about that?
What, a ban on young people smoking?
Yeah, and not selling cigarettes to different ages coming through.
Yeah, well, I thought so.
Well, that would be amazing if that actually happened.
yes, I think it's on the cards, but with the general election coming up, I'm not sure what's going to happen.
Well, I feel like we need to touch on this topic because I'm sorry, I know it's on a tangent, but there are plans to let dentists into the UK to work on the NHS. And I was reading about this today. I mean, because now we've touched on elections, we can touch on this. I mean, what they're doing is saying anyone can come in now. And I don't have a huge problem with people coming in. I just think that they're trying to now bolster a falling system whilst elections are coming in. And it's the same as mentioning this smoking ban's gonna come in. It's gonna come in. It's reactive decisions that are not well considered and are not actually going to solve the long-term problems. I'm going to get off my soapbox about this.
No,
Sorry,
no,
it was
no.
just-
No, I completely agree. I think, yeah, I think it's very good having a workforce that can come sort of from everywhere, but you've also got to have levels of protection there.
Yes.
And this isn't, it's actually not solving the problem sort of in a right way. It's very much just someone trying to plug holes desperately.
Yes, and actually, so the worrying thing is you say protections. I really like looking at it like that, but a lot of the public will see it as us trying to protect a workforce, and it's not that. It actually ends up being part of it. We're not worried about our jobs. What I'm really worried about is, firstly, people come in who might. The UK is very good at working to guidelines, right?
Yeah.
Like look at all the the nice guidelines, SCDP, I've tripped over my tongue there. The Scottish guidelines. We've got a lot of great guidelines. The Royal College come out with guidelines, and a lot of countries all over the world adopt these guidelines. So what you find is when you go to take your Royal College exams for your membership exams, you'll find people from all over the world, and people in their countries will seek them out because those exams are just about guidelines, right? So what I find interesting is people will come in. I don't know, whether they're going to take exams or how robust this will be. But the worrying thing is, if they're not working to the standards that the UK dentists are trained to, then we're going to have problems. Poor patients are going to have issues. But medico-legally, it could be a storm for us because suddenly there's more of an issue coming through. So yeah, I hope someone somewhere in the political field, maybe at the BDA, is stomping their feet, not waiting. So how long did they wait? They waited 18 years from 2006 to make noise this year about the new contract, which is 18 years old. So I'm guessing in about 2042, they'll oppose this.
Yeah. Lilia will be an adult by then.
Yeah, great. Yeah, no one will have teeth by then if we carry on at this rate. But sorry, you were talking about vaping when I interrupted.
Yes. Well, talking about laws, one of the laws that is meant to be coming in and supposedly in the next 6 months, but we'll see, is the ban on disposable vapes, which for me, I think is a massive thing that we should be doing. The amount of sort of single-use plastic that goes into them, and not only the plastic but the lithium and the cobalt is, I mean, they're all finite resources, and really sort of lithium, particularly if we're moving towards this more renewable energy future, is going to be really vital for sort of batteries and sort of like electric cars. At the moment, 5 million disposable vapes are thrown away every week.
Week. Wow. I mean, you see this, right? Like, and you hear about it. I mean, I have a daughter who's 1.5, so I go to playgrounds, and I find disposable vapes on the floor in playgrounds, and it's where teenagers will get together because they don't have 20 quid to go spend on a cocktail, so they're going to get together at these playgrounds, and it's, I understand the concern about the sustainability, which is the number one concern, but it's also just disgusting. And we look at it, and if you ever visit a country, I haven't, but I know places like Singapore ban chewing gum because it's gross having chewing gum all over the place, and they're such clean places. And overall, I think the UK is really good at, like, we don't just find litter everywhere, generally speaking, but this is a littering problem as much as anything else.
Oh my God, yeah. No, you do. You find them in, being a runner that runs on lots of trails, I'm astounded by where some of these come from. Like, I clearly am the only person that's runs on this trail. Where's this vape?
Or they're vaping whilst they run.
Yeah, literally.
So I don't understand why they're waiting till the end of the year to introduce this ban.
So it was announced a couple of months ago, and I think they've said it to roll it out with everything is going to take. The article I read said 6 months.
Okay.
From sort of there, but
so is it like grand design 6 months? So it's going to take 6 years?
Maybe.
Wow. Okay.
I'm really hoping by the end of the year that there won't be the disposable vapes, and then we can just work on the reusable ones.
Yeah.
So in terms of what vapes are made of, you have nicotine, propylene, glycol, vegetable glycerin, flavourings, and as we said before, they're made using sort of a lithium battery. I thought we could go through sort of each of the ingredients and sort of talk about sort of how it affects that dental health, and then maybe sort of oral health. And
you may not have looked into this, but do you know what the function in terms of in the vape is of each of those ingredients?
I have not.
Okay, no, I'm just being nosy, and I could have done some research, so I'll stop there. Yeah.
Yes, I have not.
I'm guessing, okay, so the nicotine's nicotine, and that's what people are getting addicted to. And then the other constituents must be there to bring that liquid together. And actually, there's more chemicals in there than people might think.
Yes.
It's not just strawberries and something else, right?
Sadly not. So in terms of nicotine, what's nicotine's effect on the oral health? I feel like this is a nice easy one.
Yeah, so the big issue is the constriction of the blood vessels, and that affects everything, right? So what we find is, especially in perio patients, there's actually very little bleeding. And then when people stop smoking, suddenly they're bleeding. The stopping smoking didn't cause your gum disease. It's that your gums were being strangled when you were smoking. So yeah, the restriction to blood flow causes most of the problems, I believe.
Yes. And it affects then that healing and all the connective tissue. The thing that I did find interesting, and I just love this term, is so although vapes have less nicotine in them, even sort of the stronger vapes, than smoking, traditional cigarettes, the big difference is the puffing topography, which I just love as a phrase, mean that actually people are taking in more nicotine than traditional cigarettes because they're constantly using them. And
it's the shisha issue.
Yeah.
You sit there for hours with your friends and you're just,
But yes, I really like that phrase, puffing topography. And the other big thing, particularly in young people, is the addictive nature of nicotine. And it can sort of affect the way some of that brain is being wired. And it's just going to make it even then harder if they're taking on that even more nicotine to quit. The propylene glycol is very acidic.
Okay.
So when we're then looking at sort of what that's going to cause issues with in terms of the enamel, you're going to get sort of tooth wear issues there. And when it breaks down as well in the mouth, it produces and I do apologise, I'm terrible at pronouncing these, propionaldehyde,
Right.
which actually irritates the soft tissues as well. So you've got sort of these working just from that ingredient alone, that it's going to sort of be weakening that tooth enamel and then affecting the soft tissues.
Sorry, a question from someone who doesn't vape and hasn't vaped.
Mm-hmm.
Do we know, or do you know,
Mm-hmm.
if then the vape is it going onto the buccal surfaces of the teeth,
Mm-hmm.
or is it going to affect the palatal and lingual surfaces?
So again, I did actually find some stuff on this, and they said it can actually be a lot more around the front, and it's similar with cigarettes,
Yeah.
where that anterior region, sort of that initial bit, is going to get more,
Right.
and then yes, on the palatal side, because you're not sort of getting so much.
Okay, so because
Buckling.
I was almost imagining, like, you know, when people bite onto a bite plate for an OPT, they're not biting onto their vape to use it. So it is just going onto their lips, like kind of like a superficial straw would be. And so we're going to see signs of tooth wear buccally on these kids potentially.
So yeah, some tooth work, yeah. Sort of, I think generally all over, but yeah, particularly where that is sort of coming in. I don't know, you find it, but sometimes in smokers, when you're going around doing sort of like a 6-point pocket chart, and you go around buccally, and you're like, oh, this isn't too bad, and then you go around palatally, and you're like, oh my gosh, the probe is disappearing, and it is. There is sort of that direct. If it's closer to that tissue, it's going to.
So sorry, you're saying that it's closer to the palatal and lingual
Yes.
tissues. Okay. So it's going, okay. Because it's difficult to separate the area that's harder to clean, so the oral hygiene, and this, but this makes sense, yeah.
Yeah, so it's a lot more in that sort of the oral cavity area. Right. The other big thing that it causes is dryness.
Yeah.
So with getting that much less of a saliva buffer, it's allowing sort of streptococcus mutans to just run wild, and yeah, that's one of the big things that's causing then a lot of the sort of periocide on and Carey's side with them.
And I don't mean to be judgmental, but the chances are, if you're someone who likes flavored smoke, you're not really going to pick up a glass of water if your mouth is dry. So there's probably a Red Bull or an Iron Brew chasing that down.
Yes.
And that's it. That's just a fact that actually, if you're using something that's going to dry out your mouth, you're probably going to follow it up with a drink. And the problem is that if that's sugar, you're doubling down on that.
Oh my gosh! And then if everything's already weakened because of it being acidic, it's just everything's even worse. Then in terms of that vegetable glycerin and the flavourings, they're very sticky, and they quite often have glucose and sucrose and all the sugars in them as well.
Right.
So you've got this.
This is in the vaping
in
liquid.
the vape itself. So this isn't even with washing down with a fizzy drink. So you're doubling that biofilm growth.
It's a little bit like it's like vaporizing a soda, isn't it?
No,
like,
literally,
we're saying it's bad enough, but this is heating it up, vaporizing it, and then throwing it at your teeth.
Yes, an aerosoled Coca-Cola, effectively.
Gosh. With a bit of nicotine. Yeah.
So that it's even more addictive to come back to. And then the last bit with the lithium batteries, yes, they can potentially explode in your face, or there's improper use can lead to burns and ulcers. There is also one other thing that I learned about. Have you heard of vapor's tongue?
No, I have not.
So apparently it's associated sort of with using e-cigarettes that you can lose your sense of taste.
Okay.
I couldn't find the exact
Did
mechanism
they
for
happen
it.
to study this when COVID hit by any chance?
That would be
Loss of
amazing.
taste, it's the vape. It's definitely the vape. It's not this virus that we're not admitting exists yet. It's the vaping. Okay.
I couldn't find a lot in terms of the mechanism of that bit, but
Okay.
I just found it quite interesting.
And kind of away from the mouth, it was really sad. You know, I think a couple of years ago there was more publicity around it. I noticed in like TV shows and mainstream TV shows, where they were really pointing towards things like popcorn lung that they were seeing in young people, and they were seeing this massive effect. And I really think it's to do with, rather than the vaping being more harmful, that the volume of it, what did you call it? The smoke topography?
The puffing topography.
Wow, puffing topography. makes such a difference because it tastes nice and it seems harmless because of that flavor, and it's fun. All these clouds of smoke coming out that actually there's an acceleration in these health problems that you see. It's quite worrying as a parent actually because I can see the appeal as well. You know, when I was a teenager, I'd have been like, oh, that can't be that harmful. It doesn't smell like something burning.
Yeah, no, it's true. Do you think it's better than smoking?
This is really difficult, and actually, I want to say yes if it's the same amount being used, but it's not going to be the same amount. I think it's better than smoking if it's being taken up to stop smoking. It's what the tool is being used for. So I think it's actually really dangerous as people taking it up who don't smoke because it's a fun thing to do or a nice thing to do. From what I've seen, I'm hesitant to say that it's as bad or worse because a lot of the people that I've treated are using it to get away from cigarettes, not using it on its own. But when I speak to patients, I say to them, we don't know. And I think that actually doing the research for us speaking today has made me realize that we're starting to know. And the fact is that it's not better.
Oh yeah. I think the big thing that I'd say, and this I found this sort of dotted around sort of all the different papers, is the overall sort of consensus is yes, it's better overall for your health than smoking,
Yes.
but worse for your oral cavity.
Okay.
And I'm not talking about sort of the cancer side here because I think that's separate there.
Yes.
But in terms of sort of teeth health particularly, it seems to be worse, and I think it's because of that sugary component on top of the nicotine component.
Do we have any idea about the cancer risk, the oral cancer risk with vaping?
I couldn't find any
data
there.
It's too early.
Yes.
It's too early. We might end up with, between lungs and the oral cavity and everything in between, we might end up with a huge cohort of people who have this problem.
Yeah. Well, I think what was interesting on the sort of the Gov website, their sort of conclusions were that it is less risk than smoking, but it's not risk-free.
Yeah.
And
well, that's as much of a cop-out as what I was saying. Yeah, great. Yeah.
And that more long-term studies are needed, and those studies also do need to be more standardized and consistent in methodologies.
So that's interesting because everything I looked at was concluding that more studies are needed because essentially we're in the infancy of vaping, and we know, I think it's well known now, excuse me if the details aren't right, but we know about the lung cancer risk with smoking because a cohort of doctors were followed, right? And through their lifetime, and by the end of their lifetime it was definitive. So do we want to wait for that much data before we go, maybe this isn't such a good idea,
Yeah.
Maybe what we need to do is come up with a contraption where you put a piece of menthol chewing gum in and you get a little spray of hot water across it into your mouth, and we say, you know what, is that good enough? Because everything I've looked at, I was wanted to talk about two studies that I found that I thought were interesting, and they were interesting in different ways. So in the first study, and I looked at this from an implant viewpoint because it's relevant to me, and that's what I thought I'd look up. So they looked at actually spraying smoke or vape onto osteoblasts.
Okay.
So in a lab setting, so this is not a clinical study. And this group, for an hour a day, put cigarette smoke, nicotine-containing vape, and non-nicotine containing vape onto these osteoblasts, and then looked at their activity. It was a very science-heavy paper, but what they concluded is that whether it contains nicotine or not, the vaping has an effect on the osteoblasts, and actually the extrapolation of that data was to say that and this was, looking at the osteoblast activity against titanium surfaces, so it's relevant to the implants. And they were saying that this could affect both the integration rate and the complication rate of implants.
Wow.
Now, I'm very careful about these extrapolations and how early these clinical studies are. But the fact is, if things are being affected on a cellular level, they're being affected. And I think it's in our best interest to proceed with caution when we look at these things. I mean, the fact is that a patient comes in, they're not asking for an implant that will work for a year. They're hoping for forever, and it's our job to say that there's no such thing as forever. But all these factors play a role in that. The thing that I found really interesting was actually the systematic review and meta-analysis that I found on, and the title is The Impact of Electronic Cigarettes on Peri-Implant Health, a systematic review and meta-analysis. Now, they were looking at probing depths, bone loss, and interleukins. So these are bone destruction mediators in the tissues around the implant. And what they found is that e-cigarettes are a potential risk factor for the healing process and the results of implant treatment similar to cigarettes. So they're putting them on par. Now, their caveat is performing clinical research to evaluate the e-cigarette effect on peri-implantitis in an age and gender matched population is needed. And what they're saying is we need to dive deeper into this. But as far as I'm concerned, that's already grounds for caution going forward.
Oh, yeah.
And it's relevant to me because I don't like to promise patients anything that we can't deliver. And I want patients to own their risks. That's the only way we can go forward in a way that ends up being a win for them. So at the moment, one of the questions I get asked is, do you treat smokers? And do you treat perio patients? And we're very open about this because it's on our workflows. And actually, we have pre-treatment workflows that you carry out, post-treatment workflows, and implant disease workflows. And so what happens is when a patient comes in and they're considering having implants, the questions that we're answering are, is there active periodontal disease? And that for us is an absolute contraindication. Now, there are people out there who will place implants on someone who has unstable perio, but the reason that's a line for me is personally, that's an evidence-based and moral line where if there are teeth that cannot be improved, then actually we should be incorporating them into the plan.
Yeah.
And if they can be improved, we should be working on improving them because we owe that to the patient, they owe it to themselves, and actually that's going to mean that the implants fare better. The one that's a bit more difficult is the smoking. And my line has always been that they have to accept responsibility for the smoking. So if they smoke and they accept responsibility, which is the different success rates, the different guarantees that we provide, and the different risk of peri-implantitis and the costs for treatment for all of that, if it happens, is very different to someone who doesn't smoke. And if they won't take responsibility for that and they don't feel that it's reasonable, then we can draw a line there. But I think based on the research that I've done in this discussion, I think it might be a case of altering our protocols so that e-cigarettes are part of the smoking protocol.
Yeah, well, it's interesting. That was actually one of the questions that got sent in was, would you place an implant on someone who vapes?
Yeah, I would, but I will now be... People used to say, oh, I'd talk to them about smoking, and I'd say, we're not sure where vaping sits between not smoking and smoking, but now I'd say, look, we're not sure, but we're pretty sure it's close to smoking, so I'm actually just going to be giving you the same guarantees as if you were a smoker, and hopefully we can encourage some people to consider it, because the fact is, there might be patients out there who think that, oh, it's fine, it's vaping, and it's an opportunity to introduce them to this data and to the fact that it might not be as safe as they think. And if they go, well, no one's, there isn't the cancer warning on the vapes.
Yeah.
Because we don't know yet. But
No.
do you want to wait till we know?
No, I know. I think what's amazing is if you look at a cigarette packet compared to a vape packet, and it is, again, it's that marketing on the cigarette packet. You've got that picture of someone's oral cancer on their tongue, and I think that we're maybe not far off something being put on vaping to show that it's not all bubblegum and pink and fluffy and
yes.
And yeah.
And actually, I mean, what they should do is really they should have plain packaging and they should make them shape the vapes like something disgusting. I can't even think of what it is. I can't think of something, but I just think they should be shaped as something that you don't want to put your mouth on. So that you're making sure someone really wants, and make them do it in front of their friends. Put your mouth on that in front of your friends and see how cool you are. Because the fact is, you know what? We owe that to the youth. Like, we've all been young, we've all been stupid, we've all done things, and if we don't put up barriers, there's always going to be someone who is trying to exploit the marketing and business opportunity. And that's the job of government, isn't it?
Yeah.
Make them not cool. That's the best weapon we have against this.
I think in some ways maybe there should be a bit more of a prescription service. So a bit with, if you're going to be using them sort of for smoking cessation,
Yes.
it's that packet of reducing it.
Yes.
Maybe it's done through the pharmacy
Yes.
rather than sort of shops and things. I appreciate this would be incredibly difficult to roll out and money wise, but something along those lines.
I don't think it's unreasonable, Flo, because there are there's diabetes programs, there's stop smoking programs, and they're funded by the NHS through local pharmacies. So shout out to Alim Hansraj, who's a friend of the practice, and he's a local drug dealer basically. He's a pharmacist. And he supplies all of our, or helps us get all of our medications, so our antibiotics and our analgesics. And he works in pharmacies where he provides these services, and he talks to me about it a lot. And actually, the sad part is, so the great thing is, there is funding for these services. The problem is if it's not funded to a level where you can make a big difference. So, with diabetes, there's no point handing everyone medication. But to make real lifestyle changes, you have to spend a lot of time with them to help them understand things. And I think this would be a really good use of funding versus some of that. So I think it's actually a great idea, and I don't think it's that unreasonable. Hopefully, maybe
well, UK government.
yeah, I mean, if you're listening, yeah.
Some sort of politician, get in touch.
Yeah, and maybe listeners send us some messages about what the vapes could be shaped as to make them not cool.
So in terms of oral hygiene advice, I appreciate this is more what I do, but what, if you were giving it now after the discussion we've had, what changes would you make?
I wouldn't change anything with the way we give oral hygiene instruction. I don't know how this would, I mean, do you have an idea of how it would change it?
So, after doing this again, like you said about changing the protocols for implants, when I say oral hygiene advice, I'm umbrella terming sort of diet advice,
right,
OHI,
okay. Preventative advice.
Preventative advice, that was much more, I definitely think I am going to go a lot stronger on the vaping, because before I was a little bit like, it's, a bit of smoking cessation there, but I wasn't confident, I think, giving that sort of the full advice. But actually there is data out there about sort of what it's doing to the teeth, and I think the more vapors that I have been seeing, and actually seeing some of the people who had stabilized their gum disease, then they start vaping and suddenly it's unstable again, even though they have swapped from smoking. And again, I think it is to do with that puffing topography. And they're having sort of such a high hit then of nicotine that before maybe they had got down to sort of 1 or 2 cigarettes a day.
But also maybe the effect on the microflora that's being brought about by things being stickier and more sugar, because that will definitely have an effect. There's nothing more powerful that we have in changing behavior than the barrier effect that we own. So for me, when we see someone, we're lucky. We're in a place where we tend to see very motivated patients, right? So people come in and they really want to, they're here because they want to invest in themselves. And if they want to invest in stabilizing it might have nothing to do with implants. They might be working with you on stabilizing their periodontal condition. And when you reach an end point where the barrier is their smoking, and one huge example of that is periosurgery. So you won't do periosurgery on people unless their OH is almost perfect, not even excellent, and they're non-smokers. And the reason for that is it's a waste of resources, not our resources. We would get paid to do this work that wouldn't work. It's because it's a waste of their resources. And when they reach that point, or their periodontal condition is not improving and everything else is great, it's like, look, there's no point us we could just go get blood tests and start looking for diabetes and things. But the fact is, you're smoking, and that's probably a huge factor. And once it's a barrier to them achieving things, I think that's a really good opportunity for them to start to reflect on how much they need it. So, for example, I now wear a whoop, and I can see what affects my sleep. I know.
No, sorry, I'd say whoop.
Whoop?
Sorry.
A whoop? It doesn't feel right coming out of my mouth as whoop. A whoop. So I'm looking at what affects my sleep, and it's forced me to look at the things that have a negative effect on my sleep and really consider how much I want those things. And it's the same principle, and actually that's more powerful than someone talking to me about how, oh yeah, if you eat too close to bedtime, you won't sleep as well. Okay, but when I can see the data, and this is the data. So from my perspective, we are in a position where we could really affect change. And from the implant consultations that I see, I can now, there's nothing more powerful than a financial incentive. Because if your guarantees are linked to your behaviors, then here you go.
Yeah. No, I think that's very fair there. That's everything that I have. You have answered all the questions that the listeners sent in.
Brilliant.
So yes, thank you for your time.
Thank you.
Definitely going to change some of the advice I'm giving regarding vaping, and going to try and get the last sibling to stop. And yes, thank you all for listening.
Thank you. I actually wanted to say that it would be really interesting if anyone out there who's listening thinks we've missed anything, because this is such a new topic and it's not something that we are experts in. We've kind of looked things up, so please get in touch. And also, if you're listening to this as a podcast, you won't see me looking at the camera, but this is available on YouTube. So if you want to watch this with producer Simon in this lovely setting, then please head over to YouTube, and please don't forget to subscribe, rate, and like the episode. It will help people find it.
Ali, why did you invest in the Navident dynamic navigation system?
It's incredible. It brings our safety and accuracy up for patients. Here's a tracker that we use, and thanks to Rob from the dental imaging company, it's been great support and so easy to set up. I see why so many people go to him for their digital imaging, 3D or 2-dimensional, and also all their surgical supplies like Ustamed screws. Rob's been incredible, and I'd highly recommend working with him.
Ali, why do you use Southern implants?
I love these implants. Brilliant. I have options like coaxis, which 38% of implants that are used by Southern are coaxis, which means that 38% of the time, if you don't have coaxis angle correction at implant level, you're compromising on your treatment plan. On top of that, soft bone implants for the pterygoids, as well as the max implants, immediates for molars, can save having zygomatic implants. Definitely the way to go.
Ali, can you name everything in the practice that's made by W&H?
Ooh, off the top of my head, all of our handpieces, our sterilization equipment, my implant motor, the PiezoMed, they're an incredible company to work with because they're an Austrian company that focus on hygiene, and we know from studies that patients care most about hygiene. To top it all off, the support we get from them is amazing. They don't actually supply the equipment, but they provide the support. Now that's true support.
Ali, what's that you're holding?
Well, this is a burr box from Crown Dental Burrs, and it has Dr. Flo King's name on it. And the reason we've implemented this in the practice is that Paul has the rota system, so his great burrs are kept in order. That means you can ask your nurse for a number of burr, which means you'll always get the same burr, and the rota system means you'll never run out of burrs. So it's definitely worth the investment, and it's not nearly as dear as you might think for something this good.